Are you ready?
Yeah.
Okay, off we go.
Type 2 diabetes is a leading cause of preventable eye loss in adults and is a major contributor to kidney failure, heart attack and stroke. As well as the cost of human health, treatment accounts for 9% of the NHS budget. This is around £8.8 billion a year. Studies have shown that people of black and minority ethnic groups in the UK develop type 2 diabetes approximately 10 years earlier than those from the white population, due to them being at higher risk. Around 80% of type 2 diabetes cases are preventable. Behavioural interventions which support people to maintain a healthy weight and be more active can significantly reduce the risk of developing the disease. However, current prevention programmes are not culturally sensitive to accommodate for the minority group. Arabs represent 0.3% of the UK population, and it is unknown how many of them are at risk of developing diabetes or currently have the condition. In fact, Arabs were first introduced as an ethnic group in the 2011 UK census, so there is little data recorded on this minority. According to the Global Burden of Disease study, diabetes was ranked number 4 for causes of death in the Arab world in 2010, a dramatic increase from number 11 in 1990. Behavioural risk factors, including unhealthy diets and physical activity, are widespread, and obesity in adults and children has reached an alarming level in this group. Due to the increased risk of developing the condition, healthcare professionals should therefore consider Arabs as an important group in which to target their diabetes screening and prevention programmes in the UK. Non-access to healthcare systems has been identified as a major factor responsible for poor outcomes and health inequalities in ethnic minority groups. The solution: a culturally sensitive behavioural intervention that meets the needs of those at risk of diabetes in the Arab minority within the UK. The aim: to improve health outcomes for those at risk using tailored lifestyle interventions to reduce health inequalities. The strategy is to lower the risk of developing diabetes in the target group through community-based specialist clinics, integrated within and cooperating alongside cultural and community faith centres, with a focus on tailored behavioural and lifestyle modifications. The human and economic burden from type 2 diabetes leaves no room for inaction. In the time I've been talking, the NHS has spent £57,000 on diabetes, and by the end of the day, over 700 people will be diagnosed with diabetes. Diabetes is an urgent public health challenge.
Why focus on culture instead of, for example, genetic screening?
Well, genetic screening at the moment, people are already being screened for that, so when you do go to the GP, they do ask you about what ethnicity you come from. However, the Arab group, they are genetically more susceptible anyway, so by targeting them, you know, you're screening the Arab group specifically.
You've still got a few seconds.
Okay, sorry, breaking the wall, thank you.